Hello everyone, today we will be discussing sutures. So for MBBS final part 2, MS surgery, DNB surgery, practical examinations. So this is description of the suture. Okay, so starting with this 30, so this is about thickness of the suture. So this is thickness of suture. So this thing, this is code, fine, this is code. So this is different for different type of sutures. Then this thing is about suture, it is absorbable suture, fine, this is absorbable suture. So this is absorbable suture. Then one more thing, it is synthetic, fine, it is synthetic suture. And then this thing monocryl, this is name given by the manufacturer, that is Ethicon, Johnson and Johnson Private Limited. Okay, then this is sterilized surgical needle suture. Then how it is sterilized, it is written here. So it is with ethylene oxide. Okay, then this is monofilament suture, more important, monofilament suture. That means it is single filament, monofilament suture. And what is it? It is polyglycaperone 25. So this is type of the suture, this is the name of the suture, undyed. Okay, it is not dyed. Then this is about manufacturer, this is manufacturer license number, this side manufacturer license number. Okay, then this side we have lot number, manufacturing date, expiry date, and we have price of the suture. So this is all about suture. Then we have needle. So this is shape of the needle, it is 3/8 circle like this. So if this is circle, if I draw the circle, so if we divide it into 8 parts like this. Okay, so 1 2 3 4 5 6 7 8. Okay, so like this. So if 8 parts, then 3/8 parts, so like this. So this is basically the shape of the suture, 3/8, fine. Then it is conventional cutting suture. So on cross section it looks like this. This is cutting, so tip is towards up, this is cutting suture, fine, this is cutting suture. Okay, then this is 26 mm is diameter of the suture from tip to this end. So this is 26 mm. So types of the sutures, so we have first absorbable sutures, in which we have natural, that is catgut, which is planar chromic cat. So first with this catgut. So what catgut, what is this chromic? Chromic is basically, so when you treat this catgut with 20% of chromic acid, fine, chromic acid, it alters the characteristic property of the suture, this catgut, and increase its tensile strength, tensile strength, fine. So this is about this word chromic. Then we have polyglycolic acid. So polyglycolic acid, which comes as in market Dexone. Okay, then we have polygalactin 910, this is Vicryl. So Vicryl rapid. Okay, and this is polydioxanone, commonly used PDS. Okay, PDS2. Then polyglycaperone 25, commonly used Monocryl, which was shown in description slide, Monocryl. Fine, non-absorbable sutures. So first in natural we have silk. Okay, then linen thread, fine, linen thread. Then in synthetic wall we have polypropylene, so which is by the name of proline, so commonly used proline. Then monofilament polyamide, we have polyamide, that is ethylone. Okay, ethylone. Then polyester, it comes by the name of ethibond. Okay, then we have nylon. Okay, a classification, that is monofilament and polyfilament suture. So how we differentiate? So here we can see this is monofilament suture, this is polyfilament suture. So in monofilament we have single strand of fiber. Okay, it is smooth and strong, important to note, there is less bacterial contamination because it is monofilament. Okay, it is monofilament, there is less bacterial contamination. Knot tied may become loose, so knot tied may become loose, fine. Then we have polypropylene. Okay, we have polyamide, we have catgut, we have monocryl, we have polydioxanone. Okay, this monocryl is polyglycaperone. Okay, then besides this polygalactin finer sizes, that is Vicryl of finer sizes, they can also come as monofilament sutures. Then you have polyfilament sutures, this one. So multiple strand, they are braided together, easier to handle, and knot tied does not slip. So it is easier to handle and knot tied does not slips, fine. So and knot tied does not slips, and that bacteria may lodge in the crevices of the suture in polyfilament suture. Then we have examples: silk, we have linen, we have polyglycolic acid, we have polygalactin 910. Exception is there, the finer sizes they are monofilament of the polygalactin 910. And braided polyamide, braided can be polyfilament, and braided polyester. Okay, so these all are polyfilament sutures. So now this is how a suture look like. So this first one is, so this is monofilament suture, this is polyfilament, and this is braided suture. So it is braided suture. This is spirally arranged polyfilament suture, spirally arranged, or a central suture. So they are spirally arranged. And this one is barbed suture. with these barbs. So this one is barbed suture. What is ideal suture material? So one thing we have to note that there should be adequate tensile strength. Adequate tensile strength in the ideal suture, and it should inside the minimal tissue reaction. So this is important. It should inside the minimal tissue reaction, and there should be easy handling property. Then good knotting quality. The knot should not slip. The good knotting quality, and then it should be non-allergenic and it should be non-carcinogenic. Fine, and it should be easily available and cheap. It should be easily available and cheap. So important is adequate tensile strength, inside minimal tissue reaction, easy handling property, good knotting quality, non-allergic, non-carcinogenic, and easily available and cheap. It's taken from Bailey and Love. So this is taken from Bailey and Lau, and we have it should be easy to handle, predictable behavior in the tissues, or predictable tensile strength. There should be good tensile strength wherever it is required and how much it is required. Then it should be sterile and it glides through tissue easily. It should glide through tissue easily in which we are placing it. Fine. Then there should be secure knotting ability. It should be inexpensive. There should be minimal tissue reaction. There should be no capillary action. It should be non-allergic and it should be non-carcinogenic. Fine. So this is about desired characteristic of the suture material. Now, important thing I'm going to discuss here in this slide is suture characteristics. So first is physical suture structure. Okay, physical structure. So we know it should be it can be monofilament, polyfilament. One thing we did in monofilament that it is smooth. Okay, it is smooth and it glides through the tissue easily, but knotting is difficult. So knotting is difficult. Fine. So knotting is difficult here. And one more thing, fracture of the suture is common. Fracture of the suture. So if you hold it with needle holder, there will be fracture of the suture. Fine. Whereas the polyfilament suture, they are braided mainly. They are not smooth. Okay, they are not smooth. They have more surface area, and there will be capillary action. So there will be capillary action, and we also know so that there will be bacterial lodgement, and to overcome these problems and to have an ideal suture, so what is done? So it is coated. A suture is coated. This braided suture is coated. This polyfilament suture is coated with silicone to make it smooth. Okay, and it is smooth then. Fine. So second thing I'm going to discuss here is strength. It depends upon thickness of the suture and the constituent of the suture. So it depends upon thickness and constituent of the suture. Fine. This is important, tensile behavior. So most of the suture, they behave differently. So there is different tensile strength for the different sutures. So it depends upon deformability and flexibility. So some may be elastic and elastic. So whenever we are applying some tension, so the length will increase, and after removing that tension, the suture will come back to its normal size. Okay. Whereas there are some suture which are not elastic, they are plastic. Okay, they are plastic. Fine. And then many suture, they demonstrate a characteristic that is known as memory. So memory, which means curling up in the shape as adopted in the package. Fine. So if the suture has more memory, that means whenever you are pulling the suture, and again it curls up to the original size, so there will be less knot strength. So then what you have to do, you have to place the multiple throws of knots. Fine. So whereas in those cases where there is less memory, so knot strength. So absorbability. So this I'm going to discuss in the individual suture itself. So again, they can be non-absorbable and absorbable, we all know. And biological behavior. Like we have catgut suture, that is proteolized, but it can cause an unpredictable action, that is it can cause irritation. Therefore such material, they are not preferred. Okay, they are not preferred. Synthetic ones, synthetic suture, the man-made suture, they are hydrolyzed, and their disappearance is more predictable. The nature of tissue, this thing also alters the biological behavior. Okay, there is presence of pus, if there is presence of urine, if there is presence of feces, so they alter the biological behavior of the suture. So let us come to sutures individual. So fine, so this is catgut suture. So this is taken from submucosa of the sheep. So this is taken from submucosa of sheep intestine or serosa of the cattle intestine. Fine, so there is enzymatic digestion by proteolytic enzymes here. So this was discussed in characteristic of the suture. So it is easy to handle and it knots well. We have plain catgut and chromic catgut. So 50% tensile strength that is left in 3 days, and 100% tensile strength that is at 15 days, and it is absorbed in 60 days. Fine, whereas the chromic catgut, the 50% tensile strength is left at 7 days, 100% tensile strength is lost at 28 days, and it is absorbed in 90 to 100 days. Okay, in some books it is the tensile strength is written as 3 to 10 days. Fine, so this is chromic catgut. You can see this is chromic catgut suture. So the needle here is round body needle, so that is why it is like this round body needle, and 76 centimeter suture it is 20, and it is 20, that is thickness of the suture. Okay, then now what are the uses? So this catgut was commonly used previously. It is a cheap suture, so it was used in ligating of small cutaneous vessel, in approximation of tissue, in circumcision, in lip or oral cavity, or in vaginal cavity, in anal canal, in vaginal cavity, in anal canal, and it was used to suture the muscle. It was used to closure of peritoneum, appendectomy, anastomosis. Previously, it was used for anastomosis. Nowadays, it is replaced by this polyglycolic and polygalactin in all these uses. It was used before bilioenteric anastomosis, then for hemostasis. So hemostasis in gallbladder bed after cholecystectomy, and then hemostasis anywhere. Hemostasis it was used, and in layered closures. So this is how it is sterilized. So first it is put in 90% of isopropyl alcohol, and then in this aluminum foil, and then gamma radiation. So it is sterilized by gamma radiation. Now you can see in the packet R is written here, sterile R. This is gamma radiation. Fine. Then we have polyglycolic acid, Dexone. So these are trade name: Dexone, Maxone, Patcryl. So this can be coated or uncoated. In Patcryl we have this violet color, Maxone is green color. Okay, so Dexone can be green or beige color. Okay, then it is absorbed in 80 to 90 days. And we have Vicryl, that is polygalactin 910. It is synthetic absorbable polyfilament suture. So again, so finer polygalactin suture like 5060, they are monofilament sutures. Fine. Then it is, so then what this 910 depicts? So it is basically 90% glycolide and 10% lactide. So this is a copolymer of glycolide and lactide. Then it is absorbed by hydrolysis. There is less tissue reaction as compared to catgut, and tensile strength is lost in 28 to 30 days. So 30 days. Fine. So it gets absorbed in 80 to 90 days. What are the uses of both polyglycolic acid and polygalactin? So it is used nowadays in all the situations where catgut were used, and like in closures, closing of layers of abdominal wall, like we are using this polygalactin for external oblique aponeurosis closure, in closure of subcostal incision mainly. Okay, then this 3040, they are used in biliary enteric anastomosis, in pancreatico-jejunal anastomosis, and 2030, they are mainly used in bowel anastomosis. Fine. Again, these suture can also be used in approximation of subcutaneous tissues. Okay. Then we have this Vicryl rapid. This is undyed suture. There is rapid absorption. It has low molecular weight as compared to Vicryl. Tensile strength that is lost in 10 to 12 days. So it is less as compared to Vicryl, and then it is absorbed in 42 days. It is used as subcuticular suture. It is used in mucosa, and it is used for circumcision. So this is Vicryl rapid. So this is Patcryl. So this is basically polyglycolic acid, and it is sterilized with ethylene oxide. You can see this is Vicryl. This is polygalactin 910. Sterilized again with this ethylene oxide, and then we have this Vicryl plus, including antibacterial properties, sterilized with ethylene oxide, and then we have this Vicryl rapid, which is undyed, and it is early absorbable, and it is sterilized with gamma radiation. Now we have this polyglycaperon, that is Monocryl, and it includes it is a polymer of 75% glycolide and 25% caprolactone. This is undyed or boiled. So this packet was undyed, so it doubles the strength of chromic catgut. It has excellent handling, smooth surface, tensile strength is lost in 21 days, and it get absorbed in 90 to 120 days. It is used where catgut suture were used. It is used in anastomosis. So mainly we are using this polygalactin, that is Vicryl, for anastomosis. We are using PDS for anastomosis. We are using silk for anastomosis. So it is also used, and it is used for closure of peritoneum. It is used for subcutaneous apposition, and it is used in some urology surgeries like pylolithotomy and for ureter repair. And commonly it is used as subcuticular suture. Fine. Then this sterilized by ethylene oxide. Here it is written EO, ethylene oxide. Now we have polydioxanone, PDS. So this is PDS. So it is paradioxanone, PDS2 suture. It is soft and pliable. Tensile strength is lost in 56 days, and it gets absorbed in 180 to 210 days. So this is loop suture, like this loop suture, polydioxanone. So this is one number. This is mainly used for closure of abdominal incision. Fine. And this we have 30. This is clear monofilament suture, and it is used in anastomosis. Fine. So in 8 weeks, whole of the tensile strength of this polydioxanone is lost. Then so 10 or 1 number or 0 number, that is used for closure. 3040, that is used for intestinal or biliary enteric anastomosis. So this is PDS, polydioxanone. It is sterilized by ethylene oxide. So silk, so it is derived from cocoon of silk worm larva. So then it is prepared by degumming. So it is braided around a core and coated with wax. Handling is best here. Knots are securely tied. Tensile strength is 2 years. So here it is more 2 years. And there occur polymorphonuclear reaction, and due to this polymorphonuclear reaction, a fibrous capsule is formed around the silk in 14 to 21 days. In 2 to 3 weeks, a fibrous capsule is formed around the silk. Okay, so this is a image showing silk suture. So with the needle, reverse cutting needle. So this is used for skin approximation or abdominal layer closure, or it is used for fixation of drain, mostly nowadays fixation of drains and tubes. Fine. Now silk without needle also, that is for ligature, used as ligature and for used as ties. So in hemostasis, like ligating cystic duct in open cholecystectomy or cystic artery, and in case of resection and anastomosis, for ligating the mesenteric vessels. Fine. Then 10 with the needle, 1 or 0 with the needle, that is used for skin closure. Okay. And 20 and 30 muscle, they're used for anastomosis, and they can be used for repair of posterior wall of the hernia, that is herniorrhaphy. And the 30, they are used in pancreatico-jejunal anastomosis. And the final one, that is 40, that is used suturing the nerves. Okay. So then it is sterilized by ethylene. Then we have this linen. So not seen nowadays. So it is made from flax, which is a cellulose. It is twisted polyfilament suture. There is excellent knotting and gains 10% tensile strength when it is wet, and it is used for tying up pedicles, and it is used as ligature. So it is not seen nowadays in practice. So it is used for tying a pedicle and ligature. And again we have polypropylene. So this is proline. This is inert. This is non-biodegradable with low coefficient of friction. This is smooth and passes easily through the tissue. There is 30% extension. It is elastic suture. 30% extension, and after 30% extension, then it breaks. Okay, good handling and secure knotting, and tensile strength is for indefinite period. It is used in herniorrhaphy. It is used for midline abdominal incision closure, and it is used for incisional hernia. Then 20 and 30, they are used for tendon repair, and 40, the final one, they are used for vascular anastomosis and for repair of nerve injury. Fine, repair of nerve injury. And then it is sterilized with ethylene oxide again. Now this is polyamide ethylone. Trade name we have ethylone. This is a raylon. This is CMlone. So this is ethylone. There is very low coefficient of friction. It is inert again. Tensile strength is for longer time. 25% of tensile strength that is lost in 1 year. Memory is there, and knot security is poor. So uses for closure of skin incision, for abdominal wall incision closure, herniorrhaphy, and final suture. They are used in vascular surgery. So it is sterilized by ethylene oxide again. This is nylon. It is white in color. It can be blue in color if dyed. Tensile strength is lost 15 to 20% per the year. Okay, and this is sterilized with R. This is gamma irradiation. And we have steel wire. So steel wire, it is also used as suture. Previously, it was used in herniorrhaphy and Thirish repair. Nowadays, it is not used there. So nowadays, it is used for patella fracture, olecranon fracture, and other fractures in orthopedics. And in surgery, it is used in midline sternotomy closure, midline sternotomy incision closure after open heart surgery, after sternotomy, and it is used for mandible fractures also. So this is how it is used. This is where it is used nowadays. So it is having high tensile strength and extreme inertness, and it is sterilized with autoclave. Now we have polyester, that comes as ethibond. It remains encapsulated. Polyester, so this is polyethylene polymer of propylene terephthalate. Fine. It is a monofilament or braided multifilament, and it is coated with polybutylate or silicone, or it can be uncoated. So there is low tissue reaction and tensile strength is infinite. So it is more than 1 year. Fine. So these are all our trade names of this polyester suture. So it is sterilized with gamma radiation. Okay. Then coming to barbed suture, so this is how this barbed suture look like. And then so barbed suture, they are absorbable, they are having absorbable material, or they are having non-absorbable material. So non-absorbable material, so this is one example of absorbable V-lock TM180. So there can be a single angle cut like this, and there can be dual angle cut like this in barbed suture. So then examples like we have this Statafix, this is spiral monocryl. So here monocryl is used. So this is absorbable suture. This is Statafix symmetric PDS. Again, the absorbable suture is used here, PDS. Then Statafix spiral propylene. So here the non-absorbable suture is used. Okay. So again, it can be absorbable or non-absorbable. So see, this is Statafix synthetic absorbable with, which is bidirectional. Okay, so I will explain what is this bidirectional here. So unidirectional is like, so this is needle, so this is needle, and this is suture, and there is a loop in one end. Okay, this is unidirectional. But the bidirectional, so there is needle at one end, there is no loop at the other end. So there we can have one more needle. So this is like this. So bidirectional. So this was example of bidirectional. This is unidirectional suture. Okay, only one needle here. So this is bidirectional. We have two needles. Okay, both. Basically, it is knotless suture. There is no need of knotting. Sizes of the suture material, this is important. So I was saying like 4, 5. This is 50, 40, 30, 20, 0, 1 or 2. So this is how these sutures are named. We are using this metric also. So 5 is for this 2 number, 4 is for 1 number, 3.5 for 0 number, 3 for 2, 20, 2 for 30, 1.5 for 40, and 1 for 50. The 2 is the thickest here. So thickest suture, and as we go down, so as the number with the 0 increases, so it is the thinnest suture. It's the range of diameter. Okay, so this is the range of diameter for all these sutures. Now needle. Know what is needle? So there is shank. So we have shank, body, and point. So this is point, this is body, and this is shank. These are 3 parts of the needle. So body, it can be round, or it can be triangular, or it can be flat. So body can be round, triangular, or flat. What here we can see the different type of cross section. So this is basically round body with the taper point. So this is taper point. Round body, tapering is cutting, triangular cutting suture. This is reverse triangle. Okay, this is reverse triangle, reverse cutting suture, reverse cutting suture, reverse cutting suture. Fine. Then this is trocar pointed suture. Trocar pointed needle. This is blunt taper pointed needle, and this one is blunt end needle. Fine, blunt end needle. So nowadays for abdominal wall closure, so these blunt end needle are used so that there will be less chance of needle stick injury. Okay, so this is blunt end needle. Now this is how the shape of circle is. So this is 1/4 circle, this is 3/8 circle, this is 1/2 circle, this is 5/8 circle, this is J-shaped needle, this is a half curved needle, this is straight needle, this is compound curved needle. So these all are shapes I'm going to discuss. So how to select a suture? So for example, you're doing a vascular surgery, you need a smooth, non-absorbable and non-elastic suture. So for biliary surgeries, hepatobiliary, pancreatic surgeries, and anastomosis, we use absorbable suture with no tissue reaction. And then we have to keep in mind, so how much support is required, and for how much. So like if you're operating a patient of hernia, so you will be needing support for longer duration. So that is why you will use Prolene suture, that is polypropylene. So for midline abdominal wall closure, we are using PDS loop suture. So because it is having delayed absorbability. Okay, then for bowel, we have to choose which type of suture. It should be like we are using Vicryl suture, we are using PDS suture. Fine. Okay. Then size of needle is also important. So which size needle, which shape needle we are using, what is the cross section of the needle. So if it is rounded, we will use for soft tissue. If we are using for tense tissue, we can use this cutting needle. So cutting needle is used. Fine. So everything is kept in mind. So whether we need absorbable or non-absorbable, we need here monofilament or polyfilament suture. Okay, so this all is kept in mind for selecting a suture material.